Nag-echo ako.
Nag-echo ka? I can so it's your echoing.
Okay. So,
it's me.
magandang araw mga convincers sa ang mga panig ng mundo kayo ngayon ay sana nasa mabuting kalagayan. Nandito na naman tayo sa isa na namang kumaatikabong episode ng Live. Ako ang inyong host, si Sir Vince. So, at pag-uusapan natin ngayon tungkol naman sa ating kalusugan. Okay. At pasensya na, hindi ko lang nakapagdamit. Medyo nakikita nyo ang aking flesh ngayon. Ayun, kakaselebrate kasi namin ng aming anniversary, no? 18th na pala, 8 years na naglolokohan ng aking partner. Okay. Ano ba yung mga topics natin for today? So, tingnan natin yung mga topics natin for today. Ating pag-usapan. Okay, wait lang. Ayaw niyang lumabas. Ayan, okay. So, ang topic natin for today, ito, no? Sa aralan, I'll discuss first about health insurance kasi nga ang pag-uusapan natin ay tungkol sa COVID-19. Tapos sa ating paranoid segment, we will talk about yung budget kung tayo or a family ay tamaan ng COVID-19, no? And sa pera paraan, no? Ito yung mga how-tos natin kung paano tayo dapat tayo mag-alaga ng isang pasyente na may COVID-19 o kung sakaling tayo man ay magkaroon ng COVID-19, tamaan tayo ng COVID-19. Pero sana wag naman, wag sana itong mangyari sa atin. Okay, so pero bago yan, syempre, hindi ko alam kung napansin nyo yung aking layout dito kanina, no? Meron tayo ngayong mga bagong throw pillows. Ayan, binili po natin yan sa Rags to Riches. Okay, isa sa mga sinuswartahan natin ng mga social enterprises. And of course, gusto natin na i-promote sila at para matulungan kasi I think mga mananahe galing sa sa payatas, itong mga gumagawa ng mga throw pillows. Ayan, nakikita nyo ngayon sa inyong screen. Ito ay gawa ng mga urban poor communities pero napakataas talaga ng quality. So makikita nyo yan, ginagamit ko ngayon dito at very comfy talaga. And if you want to shop for these throw pillows and any products ng Rags to Riches actually, ay pwede kayong pumunta sa thingsthatmatter.ph and you can get a 10% discount on their regular items when you use the code SIRVINS times R2R o SIRVINS X R2R. Okay? So sana bumili kayo para magkaroon naman ng income ang ating mga micro-enterprises at meron silang gagastusin ngayong panahon ng pandemic. So pag-usapan natin ang ating topic for today sa ating pera-aralan, Health Insurance 101 muna para magkaroon tayo ng konteksto. Pag tinamaan tayo ng COVID-19, how prepared are we financially for health insurance? So, bago ako magpatuloy niyan, gusto ko kayong tanungin muna, of course, kung gusto niyong mag-hi sa akin, pwede din naman. Meron tayong 284 ngayon na viewers. Anong health insurance product meron kayo? So, can you type your answers? Para curious lang ako malaman kung ano ba yung mga health insurance na meron kayo. And let's talk about it. Mag-compare notes tayo. Tingnan natin kung anong meron, no? So, ito yung mga iba't ibang klase ng health insurance sa Pilipinas. Okay? So, ito yung mga iba't ibang klase. Una is, we have what we call yung PhilHealth, of course, no? At yung PhilHealth, it covers both emergency and preventive healthcare, okay? So, yung PhilHealth, yan yung ating universal healthcare. At dapat talaga ay tayo ay tayo ay covered niyan kasi universal healthcare yan. Pero kung tayo naman ay may kakayahang magbayad, sana tayo ay nagbabayad niyan kasi responsibilidad natin bilang mga citizens bilang Pilipino na mag-contribute diyan kasi ito po ay pinupool yung mga contribution natin para tulungan ng lahat-lahat na magkaroon ng universal healthcare coverage. Kasi ako talaga, sa tingin ko, karapatang pantao ang pagkakaroon ng access sa healthcare. Hindi lang yung magkakasakit ka, maski yung sa preventive. And yung PhilHealth, yan yung gusto niyang ma-achieve. Okay. So, ang una nating titingnan, yun nga, yung sa PhilHealth. Tapos, meron tayong ibang kinds pa. Ito yung ito yung ating emergency care at saka ang ating preventive healthcare, no? So yung emergency care, yan ay kapag tayo napunta sa ospital at diretso tayo sa emergency room, ito ay dahil sa ano, no? Ito ay dahil sa medyo grabe yung nangyayari sa iyo, kaya emergency care yan. So hello sa iyo ngayon, okay? Ayan. So medyo fluctuate ang ating internet connection. Tapos meron din tayong critical illness na tinatawag. Yung critical illness naman, ito yung i-cover lang, may listahan sila ng sakit, tapos base dun sa sakit na benefit, no? Kung wala sa listahan, yung sakit, then hindi ka covered. So for example, nagkaroon ka ng COVID-19 at yung mga ibang sakit na ano nito, usually ang narinig ko, pneumonia, tapos walang pneumonia sa critical illness na nakasulat, then hindi yan ko-cover ng iyong health insurance provider. Tapos meron din tayong tinatawag na hospital income benefit. At ito yung kapag tayo ay na hospital, binibigyan tayo ng parang allowance sa bawat araw na tayo ay sa bawat ay nag-echo wala wait lang. Sige, sa bawat araw na tayo ay nasa ospital. Okay, ha? Sandali lang po, ayusin natin ating audio para hindi ako nag-echo. Sana better na yan, no? So, yung ating naririnig ngayon. So, hospital income benefit, usually hindi ko ito dahil masyadong malaki yung binibigay mong premium, pero lugi ka sa ibibigay nilang allowance sa'yo. Okay? And of course, always avoid insurance. Ayaw natin ng mga insurance na may kasamang dahil ay hindi maganda sa ating financial health. Okay? So, yan. So, ang health insurance coverage dapat natin ay ito nasa 1 year worth of our income. So, kung tayo ay maggagawa ng budget, ito dapat ay ito ay ating dapat na at least 1 year yung ating yan, at least 1 year yung worth ng coverage na nakukuha natin. So ito ay magiging enough na yung ating parang buffer fund kapag 1 year worth of our income yung health insurance coverage na nakuha natin. Okay, so kung meron kayong mga katanungan tungkol sa health insurance, please use #AskSirVince at susubukan natin na sagutin ang inyong mga katanungan tungkol sa health insurance. Okay, punta tayo sa ating second segment, ang ating paranoid. No? So dito sa ating paranoid segment, pag-uusapan natin ang budget kung magkasakit ang pamilya ng COVID-19. No? Magkano ba yung ating gagastusin dito? At of course, i-remind ko lang ulit kung gusto ninyo ng mga magagandang throw pillows, ayan, punta kayo sa thingsthatmatter.ph at mag-shop kayo ng throw pillows, iba pang mga magagandang products ng Rags to Riches at mayroon kayong 10% discount na makukuha if you order using the code SIRVINCE R2R. Okay, papakita ko lang saglit sa inyo ang ating mga magagandang high quality throw pillows. Ayan, ulit. Tapos, pag binili mo, actually, ito kakadeliver nila sa akin kahapon. Social. Oh, may ganyan. May malaking bag. Tapos, may cover pa siya talaga na kung ano man yan. No? Para talagang okay yung pagka-deliver sa'yo. ano to, unboxing. Tapos, ayan. So this is another design. It's really high quality. So pumili kayo ha, maganda talaga yan. Anyway, so singit lang yon. At patuloy tayo sa ating topic. Ganito pala maghanap buhay, nakakaloka. Okay, sige. So, at para pag-usapan natin kung ano ba talaga yung budget for for COVID-19, kailangan nating maintindihan ano yung mga nakikita natin na i-observe, may simptomas na ba tayo, saan tayo pupunta, no? Sa COVID-19 yung ating pag-uusapan. At para tulungan tayo na pag-usapan itong topic na ito, nag-imbita tayo ng dalawang guests, no? Ito si Dr. Aimee, kapin po yan, at saka si Dr. Raphael Abacan. Okay, so tatawagin na natin sila at idadagdag ko na sila sa ating screen. Ayan, okay. So, hello sa inyong dalawa. Okay.
Hi!
Nakamute yata kayo. Yeah, okay.
The audio is okay. I'm sorry.
Nag-echo ata si
Yeah, no,
Raph.
it's okay. So, welcome to Doctors Raph and Dr. Aimee. So, yun. So, give us a background naman of yourselves muna. So, nasan ba kayong dalawa ngayon? Saang lupalop kayo ng Pilipinas naroon ngayon?
I'm in Higakit in Surigao Norte. Kasi doctors to the barrios ako. So, actually, nandito ako sa health center ko ngayon. Naka-quarantine ako for 13th day ko ngayon ng quarantine. So, ito yung clinic ko actually. Clinic / makeshift bedroom.
So quarantine ka ngayon. Sa Surigao ka, no, Doc Aimee?
Ano yun?
Sa
Sa
Surigao.
Surigao.
Nasa Surigao del Sur ka ba? Surigao del
Surigao
Norte.
del
Okay.
Norte.
Si Doc Raph, saan ka naman ngayon?
Hi, I'm Rap, Doctor to the Barrio to Tiboli, South Cotabato. So, I'm in my house now. Nag-shelter ako ng onte kasi umuulan na naman. It rains here every afternoon. So, rainy mountain weather dito.
Right, oo. So, mga kaibigan, si Rap at saka si Aimee actually ay mga doon sa college. At ngayon, mga doktor na sila. At I'm really very proud kasi they challenge to the barrio. Kaya si Aimee ay nasa Surigao del Norte at saka si Rap naman ay nasa South Cotabato. So gano'n na kayo katagal dyan?
It's been 6 months. Basta nag-start kami this year pa lang.
End of
And
January.
how many years yung post?
3.
3
Years kami dito.
years! 3 years! Okay, sige. So yan, no. So maraming salamat talaga sa inyo kasi very rare, no, may mga gumagraduate ng medisina tapos ay pupunta sa field, no, at nagiging doctor to the bars. Pero what made you make this decision? Bakit kayo nag-decide na maging doctors for the barrio?
Rap, ikaw muna.
Gusto ko pa talaga magtrabaho sa public health pero sa aking palagay, pananaw ko po, importante po kasi yung experience po sa pakikisalamuha po sa mga komunidad. Iba po kasi nakuha mo kapag bumaba pa po kayo sa pinaka primary care level. So sa level mismo ng mga munisipyo, sa mga barangay, na feeling ko nung medical school po naging kulang para sa akin. So really personal growth po ito, and I feel like sa nakalipas na 6 na buwan, sobrang rich na po ng experience ko dito, especially since first job ko po at nagka-pandemic pa.
Nakakaloka, no? Talagang napuruhan. Gusto nyo ng experience, ha? Okay, sige, pandemic agad, di ba? So yun. Okay, so si Doc Raph ay may siyang in the public health sector. Naku, baka ikaw ang ating future health secretary na I think kailangan natin ngayon may puso na health secretary. Ikaw naman, Aimee, anong dahilan bakit ka nagpunta dito?
I really
Doctor to the Barrios.
Primary care kasi. Primary care is all about parang preventing diseases before they even happen. Well, that's one major aspect of it. Or treating patients ng before pa lang na maging malala yung sakit nila, even before they need to go to the hospital. Kami yung the ones in charge of helping them navigate the health system. And I really wanted to be yung parang first na link nila to the health system. So I think Doctors to the Barrios is really yung the program na fit for me kasi here ako yung medyo boss ng clinic ko. Tapos ako pa yung naghe-head ng, di naman naghe-head, pero ako yung one of the major stakeholders na involved sa response ng municipality ko to the COVID pandemic. So that's like, wow, biglang a huge weight on my shoulders. That's first job ko pa lang to, di ba? Bongga. But that's one of the things I love about Doctors to the Barrios. Kasi ang dami mo ng responsibilities kaagad. And I feel like mas marami kang...
Okay, sige. So mukhang talaga... So mukhang talagang gusto natin ay challenge in our work and the opportunity to learn nga and use this eventually. Okay. I'll show you I'll show this benefit package from PhilHealth, no? Kapag tinamaan daw ng COVID-19 tapos mild yung kaso, nasa 44,000 yung budget dyan ng ating ng PhilHealth. Tapos pag moderate, nasa 143,000, severe 333, and then critical ay nasa 786,000. Yan yung i-cover daw ng PhilHealth. Pero gusto ko sanang mas maintindihan, ano ba yung ibig sabihin kapag sinasabi nila, bago tayo pumunta doon sa mild, ano muna yung asymptomatic na COVID case? So, sino gusto mag-explain sa inyo niyan?
Raph, go.
Okay, sige. So, si Raph, o si Aimee?
Sige. Asymptomatic cases po, ibig sabihin po ay mga cases po na positive po kayo sa COVID, pero infectious na po kayo at nakahawa na po kayo. Marami po kasing kaso na may COVID po ang isang pasyente or isang person, pero wala po siyang sintomas at nakakahawa po siya. Dito po yung naging kaibahan po ng SARS-CoV-1 sa SARS-CoV-2. Sa SARS-CoV-1 po, ang unang SARS, kung naalala niyo po or kung naabutan niyo po, nakakahawa lang po siya kapag may sintomas po kayo. Pero ang SARS-CoV-2 o ang COVID-2019 po, nakakahawa po siya kahit hindi pa po kayo kahit wala pa po kayong sintomas. So yan po ang asymptomatic po.
Okay. Ito namang mild case, mild pneumonia. Hindi ko actually, bakit pneumonia yung nakalagay? So automatic ba 'yon na tayo ay magkaka-pneumonia kapag COVID-19 ang pinag-usapan? Aimee?
Depende po yun kasi based on what we've observed now, hindi po lahat ng magkaka-COVID-19 ay madediretso sa sintomas. So as Raph explained earlier, may mga asymptomatic or yung mga walang sintomas. But there will be some people, especially yung mga may tawag dyan sa English comorbidities or yung mga may ibang sakit katulad ng hypertension, diabetes, COPD, basta usually yung mga naka-maintenance na medicines, sila yung mas likely na mapo-progress into pneumonia or sila yung mas likely na mag-exhibit ng symptoms katulad ng ubo, sipon, lagnat. So yung tawag ng symptoms na yon, those are called mild symptoms and we would classify them as mild cases. So not everybody naman na counted as mild ay kailangan mapapadala sa hospital. Actually, yung sa DOH, may ni-recommend sila na tawag dyan, treatment and monitoring facilities. So all LGUs are actually required to have one. Para silang hospitals, but are equipped to treat simpler cases like yung mga pneumonia. Those facilities naman are required to have yung mga simpleng medicines lang. So, yung purpose ng ganong facilities is really just to handle yung mga mild cases. So that not everybody ends up in a hospital and the hospitals don't end up getting congested.
Okay. Sige. Tapos, so yung ano natin, yung sunod naman natin, ano pala, no? Sabi ni Mercy, mahanug daw siya at mag-ingat ka daw.
Yes, that's in Higakit.
So,
Hi, Mercy.
Ayan, okay. Ano naman itong moderate? So, kasi meron tayong mild, moderate, tapos severe, and then critical. Sige, so i-explain siguro ni Doc Raph yung ano yung moderate at saka severe.
Sige. So, yung classifications na yun ay nakukuha po sa World Health Organization po sa spectrum of disease na nakikita nila sa COVID-19. Nakakategorize po siya as mild, moderate, severe, and critical. 40% of COVID cases are mild. Another 40% naman po, yan yung moderate. Ang ibig sabihin ng moderate, may or may not require hospitalization na po. So, yan yung tipong cough, colds, difficulty of breathing, pero hindi medyo nahihirapan pa lang po. Yung susunod naman po, there's the 15%, that's the severe. And then those may require oxygenation support na po or via O2 cannula or face mask. And then yung 5% na po, yan yung critical. Kailangan na po silang tubuan. Sorry, medyo nag-skip ahead po ako. So yan po yung categorization. And then nakikita niyo po yung spectrum of disease. And then, yeah.
Anong classification yung malalagay na tayo sa hospital?
Yung kailangan na po ng hospitalizations po, it goes from the moderate to all the way up to the critical cases po. So as much as possible, kapag mild po, we want to keep them at the community level to save space on the hospital, to save space po on the very scarce resources that we have in our hospitals and public health system.
Okay, so pag mild doon sa isolation or quarantine units ng LGU, tapos kapag moderate, severe, critical sa ospital. And then, yung mga asymptomatic na nag-test ng positive, saan sila?
For example, for our LGU, I have 3 active cases already who presented initially as asymptomatic. They're positive via RT-PCR. However, they have COVID-19. For those cases, we still make sure to isolate po because that is our main defense po against having community spread or community transmission of the disease. So yung ginagawa po namin po is we provide po yung space po para sa kanila to be able to isolate the disease po, and then they're kept for a period of 14 days, and then once that period is finished na po, they're counted as not infectious na. So dun po sila sa sa community isolation units namin.
Community facility pa rin. Okay. So balikan ko lang tong package na to. You know, understand mild, moderate, severe, and critical. At ito yung mga yung package na binibigay ng PhilHealth. In your experience, ano ba to? And what you've read, and of course you're in the medical profession, malamang nalalaman ninyo magkano yung hospital bills, no? Ito ba ay practical at enough na ba ito or kulang pa?
Based sa experience.
Yes, Aimee.
Well, it depends kasi kung saang hospital ka na-admit, firstly. Siyempre, kung nasa private hospital ka na-admit, it would cost more. PF ng doctor, yung facilities are more higher quality compared sa public na hospital where you can end up sharing a single bed with another person, diba? Yung based sa nakikita ko dati. So, yung sa mild pneumonia na package which costs around 44,000, that would be adequate kung sa public ka na admit. But I think you were in a private hospital, parang may babayaran ka pa rin na out of pocket based on that. It would cost you around 40 to 60,000 siguro yung dapat mong handaan na pera if you have mild pneumonia.
Pero actually, 'di ba ang reality, no? Marami sa atin ay hindi mataas ang trust sa public health. I mean sa public hospitals. Kaya nga actually dito sa Manila, ang sinasabi nila ang mga unang napuno and even in Cebu ay yung mga private hospitals, tapos saka pa lang napupuno. Ngayon, no, nakakargahan yung mga public hospitals. So in this case, how do you reconcile that, no? Alam ko kayo ay nagiging part ng solusyon para tumaas yung quality ng ating public health. Pero ano pa yung dapat natin na makita para talagang magkaroon ng kumpiyansa yung publiko sa public health system natin? Parang ang hirap sagutin, no? Sorry ha, I'm putting you on the spot.
Actually, yun nangyari. I'm not so sure kung the fact that mas nauna na puno yung private hospitals kaysa sa public, di natin masisigurado na that means that walang tiwala yung public sa public hospitals. It could also mean, well, I can't say for sure kasi hindi naman ako nag-work sa Cebu, but it could be a sign that public hospitals might have been refusing patients, or private hospitals might have been more willing to accept COVID patients. Kasi let's all remember na hindi lang naman COVID po yung sakit dito sa Philippines, may iba pa that have existed for centuries, diba? So it could have been a reflection that private hospitals were more willing to accept, or more capable even to accept patients.
Doc Raph, yung sa critical pneumonia at yung sa severe, yung tignan natin, no, it's 300,000 and 786,000. Dun sa mga cost na nakikita nyo sa private hospitals, enough din ba yan or kulang?
From the private hospital where I used to be an intern at, medyo malayo pa po yung coverage po sa kinakailangan po. Especially when you're considering na kung sa private hospital ka ba mag-treat at the critical level, it's not just oxygen anymore that you need. You need to pay for the professional fee of your critical care intensivist, all of the medications you would need to keep a person alive at that point. Kasi ang dami mo, at that point kasi mag-shut down na yung body mo, your blood pressure will drop. So you need to have so many drips or so many more additional IV medications to keep someone alive, keep their blood pressure at a level na may dugo pa rin na dumadaloy sa katawan ng isang tao. So at 700,000 pesos for a critical case, that is not going to be enough to keep someone financially well sustained at that level. It's not enough.
Okay, just ko, no? So talagang magkano yung usually inaabot niya ngayon?
Sorry, I didn't catch that.
Mga magkano yung tayo sa critical for COVID? Magkano yung na cost?
Critical pneumonia? Sa private hospital? Can't really give you might have to prepare a couple million pesos. Like in a really good hospital.
About may pinakamataas na nakita ko umabot na pero ang specific na question is yung ating bang public health kaya ba niyang treat yung severe and critical cases?
Sige, to give you an example, in my municipality, I mean in my province, we have ano ba to? How can I say? We have some space available. There's a hospital that has already been designated as the COVID referral hospital. It has a 200 bed capacity right now, and then that's already like very optimistic na. But that's 200 beds for how many municipalities in an entire province? And then considering also that our neighboring provinces do not have much space din on their part. My province is across in the region. It's one of the better off provinces. Tapos ayun we're if you're thinking about like a community transmission case, like a community transmission scenario, it's not going to be enough. Kaya it's scary to imagine na ngayon pa lang at one point naka-receive na ako ng text asking if I can go on duty in one of the hospitals here kasi naubos na sila ng volunteer kasi marami ng doctors ang na-quarantine, part of the job naman but at ngayon pa lang they're already looking for additional workforce and doctors. It's scary to think what will happen if we reach a point of local transmission, lalong-lalo na now that we're moving towards opening up our borders and opening up our businesses. How ready is the entire country to receive the increasing number of severe cases? Do we have enough beds? Do we have enough ventilators? When I first checked, the entire province had not enough. I'm not gonna say how many exactly, but it is shockingly not enough. But we're getting there. And then I have trust also in the provincial government that they've been working towards a solution. But ayun, it's a struggle, and then it's a race also kasi we're trying to catch up to decades of public health that should have been invested on earlier. So we're catching up and then ayun, pabilisan talaga.
Okay, sige. So actually ito nga sinasabi ni Gloria we are talking about the cost kanina. Sabi niya kulang daw yung coverage talaga ng PhilHealth. So mga nasa 2.5 million daw yung nagastos for a private hospital 6 weeks for one nanay. So yan si Gloria Taripe, yung nagbigay siya ng information sa atin. So well, dito talaga makikita natin na malaki ang gastusin for treating COVID-19 at hindi siya biro na ang kakailanganing pera. So kung punta tayo dun sa public facilities natin, yung PhilHealth, mayroon siyang maibibigay sa atin. Kung sa private ka pumunta, hindi yon enough. Pero kapag sa public ka pumunta, enough, pero meron bang bed for you? Yun yung kailangan na mga masasagot natin. Okay, so well, it just goes to show talaga na kailangan pa natin na dagdagan ang ating insurance at ayusin ang ating income stream, ayusin ang ating budgeting para talagang mapaghandaan sakaling tayo ay tamaan ng COVID, So dito na tayo sa ating pera-paraan segments. At itong pera-paraan segment ay ito yung how-tos ko, So COVID-19 healthcare tips naman yung pag-usapan natin. Of course, bago yan, patalastas ulit, rags to riches, 10% discount if you use Servin's R2R sa Things That Matter PH. So napakaganda po ng kanilang mga pillows. Ayan, makikita nyo. Ayan, okay. Sige, so patuloy natin. So tingnan natin, ano ba yung mga sintomas ng COVID-19 bilang pagsimula natin dito sa ating discussion for pera-paraan on healthcare tips. So nagtuturuan silang dalawa, okay? Okay, so si Aimee yung natin kasi kakatapos ni Raph. Okay.
Ano yung mga sintomas ng COVID-19? Syempre alam na natin, ubo, sipon, fever, dati people used to think it was loose bowel movement or yung pagtatae. Pero ngayon parang hindi na siya masyadong kina-consider. Yun, mostly yun, paghirap sa paghinga, difficulty of breathing. Yun, yung apat na yun.
Okay, so ito yung mga sintomas no natitignan natin pag COVID-19 yung pag-uusapan. Okay. So yung next natin na tignan, so kapag ako nakaramdam ng sintomas, ano yung dapat kong gawin? Dapat ba pumunta na ako sa emergency room agad ng ospital or ano yung step by step para malaman ng mga nanonood sa atin?
Kung may ubo ka man, sip-on, or fever, the first thing you should do is really contact your local doctor. So lahat naman po ng areas sana may naka-assign na doctor. Usually naman, meron silang hotline that you can contact. So number one thing you should do, alamin mo muna kung ano yung hotline ng area nyo, and then contact them if you ever experience any symptoms. Tapos sila na po yung magde-decide kung talaga bang kailangan na i-hospital or kaya naman siguro lang sa bahay i-treat, ganun po.
Okay. Sige, so yun yung procedures, no? Nung nag-imbestiga kasi kami, ito yung sa amin local health. So, ipaki-confirm naman kung tama. So, pag nagkaroon ng sintomas, yes, ubo, hirap paghinga, at lagnat, no? Yun, una is stay at home daw muna. And then yun nga, call your municipal or provincial task force COVID-19. Tapos yung health personnel na will bring patient or to the quarantine or isolation facility or gaya nga ng sabi mo, Doc Aimee, no, na baka pwede naman sa bahay. Okay. Ito lang yung mga pictures na pinadala sa akin sa areas, no. This is in Bonawan, I think this is Agusan del Sur. Ito yung isolation facility na itinalaga ng local government unit for this area. Tapos mayroon ding isolation facility. Ito naman ay sa Bislig City o sa mas social yung sa Bislig City, yung kanilang isolation facilities. So at least nung nakita ko to kasi hindi ko honestly hindi ko ito nakikita sa social media and sa news. Ano yung mga local preparations na ginagawa for this. At saka hindi ko rin alam baka naman okay, may building lang diyan tapos nilagyan lang ng tarp na isolation facility. Yun na daw yun. Hindi ko alam kung ano yung what's really going on there. Pero sa inyo, ano yung mga ginawa ninyong preparation at ano yung nakikita ninyo na ginagawa dyan sa local government unit where you are assigned? So, Raph, si Doc Raph.
So, yung sa Tiboli, that's where I work, we have an interagency task force inside of our municipality. And then it's been a very good partnership with different stakeholders in the local government scene. Yung pag-coordinate po happens from the provincial level down to us sa LGU. Normally, we get information on incoming flights from our tourism officer or our DILG officer, who then informs the pickup team who's in charge of picking up the patients. So our objective po sa pag-pick up sa mga patients natin up to their isolation is dapat seamless po ang pag-quarantine, ang pag-isolate. So wala pong makakalabas na sarili-sarili lang po. Lahat po ng movements natin, napaka-coordinated po. Yung principle kasi na ginagawa natin is to make sure na hindi po makakalabas ang virus sa pag-isolate natin sa mga pasyente or repatriates or OFWs natin. One term po na ginamit po ng isang expert or infectious disease expert is leaky bucket. Ang pandemic na to kasi one small leak lang po, mas mahirap na po kasi ma-contain na po ang virus kung may just one patient na makalabas at makapasok sa barangay at makahawa po. Kaya napaka-importante po na at every step of the way, isolated po siya. So yan po. So sa pag-pick up sa airport, dinadala namin sa municipal isolation unit namin. And then the intake interviews are done para malaman namin yung history niya, kung travel history, exposure, symptoms also. And then at which point, we receive them and then we keep them inside of our municipal isolation unit while we are coordinating with the barangays to have them transferred to the barangay isolation facility. So may another level pa yon. At any point, kung magkaroon po sila ng sintomas, gumagawa na po kami ng swab test. Luckily, in our province, nakadevelop na po ang provincial government ng sarili nilang COVID lab. Na-achieve na po namin yung ideal scenario of less than 24-hour turnaround time for laboratory testing. So we have our own PCR facility, which has been very important and crucial. At kaya po namin nalaman na meron kaming 3 na nag-react si Aimee. Kaya po namin nalaman na meron po kaming 3 active cases of COVID. And then that's okay kasi with more knowledge, there's more ability to give the correct care. And then important din po yung ginagawa namin na counseling po. Katulad, very similar po siya sa HIV counseling kasi napakagrabe po ang effect, napakabigat po ng effect ng COVID status. I mean, 'di ba? May COVID status na, may yung COVID status ng isang pasyente para sa kanya. It's such a big effect on them because it's always on the news. And then grabe talaga yung mental health aspect dito. Pati yung pag-integrate po sa barangay. So napaka-importante yung yung cooperation and then yung participation po ng social workers and then the barangay captains. So yan po yung ginagawa po namin eh. Ayaw po kasi namin yung may kumakalat na fake news or hinaharas yung pasyente, which has happened before, na may fake news na hala, mapipick up ka na ng province, dadalhin ka na sa hospital. What? May ganon na nangyayari. Tapos yan, nahaharas yung pasyente. Oo. Kapag hindi po maganda yung coordination. So, but really, everything that we're doing has been a product po of the LGU innovating and adapting to all the surprises that that happened to us, all the surprise policies that have been happening to us. So we're doing our best. We're trying our hardest po.
Okay, so it's nice, no? Pero yun yung nakita ko on at least meron kayong testing facility, may isolation, pero sa treatment, yung inyong mga ventilators, oxygen, ganyan, facilities, kumusta?
At the level of, sa community level kasi, nasa amin lang po ang mga mild to moderate cases. We have purchased po additional medications. For example, if we have cases of secondary bacterial pneumonia, we have antibiotics ready. We also purchased additional oxygen just to prepare for in case we need to start treating patients. Pero yun nga, sa mild cases, wala naman po talagang treatment na kailangan eh. Just supportive medication. Kung may fever, bigyan ng paracetamol. Kung inuubo, bigyan ng calamansi juice na may honey. Opo. Reassurance po. Kapag mild, parang trangkaso siya eh. Pero kapag severe, severe to critical cases naman po, that's the realm of the higher facilities. So may levels kasi. So yung sa higher facilities naman, patuloy po ang trabaho ng province po sa pag-capacitate po sa hospitals namin, sa pag-upgrade ng facilities. Ayun po. I can speak mostly for yung primary care level sa communities. But as far as I know, the province is working hard to increase yung capacity namin.
So may split pala yun, no? Yung inyo, primary so yung split ninyo is primary healthcare that is mild, asymptomatic up to moderate. And then dun sa severe and critical, yun na yung sa higher facilities. So kayo pala yung mga frontliners talaga, yung mga nauuna, no? At itong sabi lang ni Rosh, sabi niya, wala bang instant testing muna pag may symptoms na? So ano ba yung mga testing na mga ginagawa natin, no? Ito yung nakita namin when when asked the local government, no, ang tinanong namin, ano yung mga gagawin for COVID testing? So, una daw ay temperature check, tapos mayroong tinatawag na rapid antibody test, and then meron yung PCR test. So, ano yung pagkakaiba nitong dalawang test ito? Doc Aimee? Okay, mukhang naka-freeze. So, muna ulit, Raph.
So yung sa let's say yung sa temperature check is ayun screening that we do to check if someone has a fever, to check if they already are symptomatic. Doon po madedetect kung yan hindi mo masasabi na COVID agad kapag may fever. That requires additional testing. Which I will talk about, and then that's PCR. Okay. So unahin ko naman, isusunod ko na lang siguro yung rapid antibody test. Very controversial to ngayon kasi for some medical professionals or institutions or even workplaces, ginagamit na po ang rapid antibody test as the screening po because it's convenient, it's fast, it's what's available. It doesn't require a laboratory facility. Kailangan mo lang ng medical technologist to be able to conduct and a doctor to interpret the results. So dapat yun, it's like a pregnancy test very easy to use siya and readily available. Pero the pitfall is it uses antibodies po. And antibodies are the defense that the body creates in reaction to an infection. However, there's a period in which a person might be positive with COVID but the body has not yet developed antibodies pa. Kumbaga, bago pa lang yung infection, hindi pa siya nakakagawa ng antibodies, which poses the risk of having what you call false negative. Ibig sabihin false negative na akala mo na negative yung pala hindi. Okay? So yan yung risk. So it might give you a false sense of security kasi kung negative ka sa rapid test, you're saying, oh yeah, I'm negative, I don't have COVID, but that might not be the case nga. You might actually be positive pero wala ka pang antibodies for it. Which brings me to the gold standard of testing, which is the RT-PCR. Yung RT-PCR, it requires a high-level facility or high-level laboratory to run the test, which is why it's been a struggle kasi nationally to get laboratories ready to be able to do yung adequate testing using RT-PCR. That's what we do now sa province ng South Cotabato. Kapag meron na po kami mga symptomatic cases, tama po yung isang comment na nakita ko kanina, tama po yun, instant testing po yun. Kino-confirm na po namin or i-check na po namin agad kung meron na po siyang COVID. Ayan. However, the capacity is it's still scarce at our level. Yung sa level namin, our laboratory can only do so many tests. And then every day, alam ko na lumalapas na sila sa maximum ng capacity nila because they're working their hardest Ayun so it's still scarce. So mas kaya pinaprioritize namin talaga ang isolate first and then test later kasi we can't afford to test everyone. What we can afford is to isolate kasi that's the cheaper alternative. Yan yung feasible.
Okay. Tanong natin si Doc Aimee, kung sa area niya ay mayroon na bang PCR testing ba 'yan? Yung gold standard na sinasabi ni Doc Raph.
Actually, yun yung medyo nakakalungkot kasi if all the regions in the Philippines, nakita ko lang sa listahan kanina na pinublish ng DOH, Region 13 or Caraga pa lang yung walang sariling testing laboratory. So actually for the past, since the start of the COVID pandemic, we've been sending out our samples to Davao kasi sila na yung pinakamalapit na testing lab. So medyo kawawa din yung Davao on their part kasi parang at that time, lahat ng samples in Mindanao were being sent there. So parang na-overwhelmed talaga sila. Pero lately, buti naman nagka-lab na yung kay Raph na province at Cotabato. And then sa Cagayan de Oro recently, they na-approve na yung third na lab nila. So they already have 3 in the city alone. Unfortunately, sa Caraga, nasa 0 pa kami. I know they're working on it, pero nasa 0 pa kami. And we have been relying on those instant tests or rapid tests as our main way of screening those na, yung tawag dyan, LSIs, locally stranded individuals, yung mga pumapasok sa province namin. So, lahat ng, yung proseso namin, pag may, let's say, taga-Higakit ka or taga-Surigao del Norte ka, tapos na-stranded ka, let's say in Manila or in Cebu, you will first undergo a rapid antibody test sa mga ports of screening namin, like say sa pier or sa highway kung saan yung border ng Surigao del Norte. If it turns out negative, ika-quarantine ka. If it turns out positive, they will send you to the quarantine facility in the province to be swabbed. So based sa ganyang protocol, nakikita mo na not everybody is really entitled to a swab, although in an ideal world, yun yung mangyayari. But for us, we have been using the rapid tool as a screening tool or as a way to determine, to prioritize who to swab and who to not swab, given na wala kaming lab and medyo mahirap pa yung process of getting the test done because it has to go to Davao pa.
Right. Okay, so yung pinag-uusapan natin ay yung sa inyo is on the mild and asymptomatic to moderate. Okay, so tapos sabi ninyo pwede pala na at sa bahay lang iti-treat, no? So how does that happen? Ano yung mga healthcare tips natin kung nag-positive yung family member natin sa COVID? Tapos sabi ay, oy, puno na dito sa isolation room namin or sa quarantine. Sa bahay na yan. So anong dapat namin gawin?
Well, we advise, so far pa naman, wala pa kaming nag-positive na kailangan sa bahay maka-quarantine. But kung meron man, we would advise pa rin na ideally, siya lang mag-isa sa bahay. Kasi yun yung important na wala siyang close contacts, especially yung mga matatanda, yung mga may maintenance medications, yung mga may high blood or diabetes, yung mga tawag na at-risk populations. As much as possible, siya lang mag-isa sa bahay. And then, lahat ng meals, ihahatid na lang sa kanya. So, sadly, bawal mo lang makikain sa ibang tao for that period of time na naka-quarantine siya. Kasi nga, quarantine. And so, then, walang bisita.
Iwan mo yung pagkain niya sa door. Tapos,
yeah, iwan yung pagkain sa door. And we always advise, aalis na lang, sadly. And we always advise...
Paano yung paglalaban ng... So, sinong maglalaban ng for all?
What was that? Sorry.
Sorry. Kung kunwari yung sa care, no, yung laundry, sino yung gagawa nun? Siya ba mismo or ipapalaba niya sa ano? How do you do that? Mga practical yung iniisip ko kasi na mga tanong na pwedeng mangyari.
Yung person that should be assigned to deliver care, yung mga regular na yung pag-support sa patient natin, should be one person, first of all, one person lang, and then should be a person without comorbids, wala po siyang hypertension or diabetes, at dapat hindi po siya elderly. Kasi iniiwasan po natin yung magkahawaan or magkaroon ng severe pneumonia or severe COVID. Ayun po, limit contacts as much as possible. Tapos, yung sa laundry, dapat yan, mag-gloves ka, you make sure na, actually may specific list of instructions yun for laundry. Actually, I can share it with you later on. Gumawa din kami ng short pamphlet for our community here. So I can share it with you later.
Tapos ang tanong ko din ay kunwari, yung bahay kung nasaan siya, dapat ba ay nakasarado or yun yung mga kunwari, paano kung magkakatabi yung bahay namin tapos kailangan open yung bahay, di mahahawa ko yung nasa kabilang bahay or something.
This is an interesting question because for the longest time kasi yung thinking natin is COVID is infectious. Yung transmission niya is primarily through droplets. That means you have a radius of about 3 meters kung saan lumulutang ang virus until it reaches the ground. It lands on droplets. Pero ngayon may lumalabas na opinion among a growing body of science na airborne pala siya or lumulutang sa hangin ng ilang oras. Ano po yung importante dito? Kasi yung risk of infection po is dependent on the viral load. O, ibig sabihin nun, kung gano'ng kadaming viral particles yung malanghap mo or ma-receive mo through the air. The best way you can avoid airborne transmission is, yes, maintaining distance, but also increasing yung number of air exchange rate ng kwarto mo. Medyo complicated siya pakinggan, pero air exchange rate, yung ibig sabihin lang po yun, is yung pag-exchange ng hangin sa loob ng isang kwarto. So, the more air movement, the better po. So, open windows, open doors, best scenario po yun. So, open air po talaga para hindi po mag-accumulate ang virus sa loob ng isang kwarto. That said, importante din po na may barrier po between the rest of the household and then yung infectious patient. Kung maaari, iwasan po talaga yung contact dun sa patient, and then mabuti din po na ma-advise ang pasyente na magsuot po ng mask para maiwasan po talaga ang risk po na makahawa po siya.
Okay. So, yun, no, magmamask siya, tapos kailangan maganda yung ventilation sa kanya, no, sa bahay. Okay, so very practical yung mga nakukuha nating tips. Pero I think ang isa din na madalas na natatanong sa akin ay ito ano ba yung gamot na ibibigay kung sakaling sabihin na, okay, ititreat natin ikaw sa bahay kasi mild ka lang naman or moderate lang naman yung iyong sakit. So ano yung dapat ihanda namin? Mag-hoard na ba dapat kami ng malaria ano na yan? Mga ano man tawag doon sa gamot doon sa malaria pill na yan? So anong dapat namin gawin? Anong gamot yung paghandaan?
Well, that's a tricky question. And I guess ako na yung sasagot kasi tapos na si Raph. Wala actually talagang gamot. Walang cure yung COVID-19. I mean, if there was a cure, di sana tapos na to lahat, di ba? Sadly, wala pang cure. Although there are some drugs na pinapa-research ngayon. But for those sa level, yung gamot na binibigay namin, depende sa symptoms yon. So, for a mild na cough, well, preference din na doktor. So, for me, as my preference, yung bibigyan ko usually mga lagundi, pinapainom ko lang ng water, ng madami. Actually, yung tuob, I do recommend tuob or yung steam inhalation para sa mga tao na may clogged nose, yung mga sakit ng sinuses, kasi nakakatulong yun sa pag-loosen up ng mucus. So yes, I would actually recommend that for sticky na mucus or parang mahirap na tinghutin na sipon. So ayun, lagundi, and for those na mukhang allergic yung reason ng cough, I would give cetirizine. Iba-iba talaga, kaya mahirap mo yung sagutin.
So kung ano yung sintomas niya, kunwari nilalagnat siya, di bigyan mong paracetamol. Ganun ba yun?
Paracetamol for the fever, yes.
O siya, di bigyan mong cough syrup. Ganun ba yun? Okay, sige. So fairly naman pala, no? Fairly straightforward siya. At yun, and I think gusto ko lang i-show to, no? Si Claro Ordonez, sabi niya, prayers for all of you, docs. Our frontliners din. Tapos may bumabati sa'yo, Doc Raph. Hindi ko alam kung kilala mo si Alvin Chumacera. Hi, Dr. Raph daw. Ayan. Anyway. So, ayun.
Raph, wrong spelling.
Ayun. Tapos si Minda, sabi niya, ayun nga, so base on symptoms yung gamot. So mukhang alam naman, no? So at least naririnig natin ngayon na hindi naman pala death sentence yung pagkakaroon ng COVID, no? So ano yung natin? Ano yung chance of recovery kapag nagkaroon ka ng COVID-19?
Well, hindi ko pa nagawa yung math. I haven't done the math. Pero based sa current na data ng DOH, actually around 95 to 97 or 98% pa nga yung mga may sintomas. So the rest of the people, yung 2% na yun lang sila yung talagang requiring hospital admission. But majority of COVID cases, mild lang talaga. I think nawala ako. Sorry.
Hindi. Si Rap yung nawala. Hindi si Aimee. Ayan, okay. So yan yung chance of recovery natin. Ito lang yung mga figures natin for mukhang tayo muna, Aimee, kasi nawala si Rap. So we have 38,000 active cases, 52,900 na yung natin, no, yung ating cases ngayon. So anong masasabi mo sa pagtaas na nangyayari? Are we moving towards the right direction given these figures coming from the DOH?
Honestly, that's a very tricky question to answer nga. Ika nga ni Rap, it's a very tricky question. Kasi on the one hand, yung pagtaas ng cases, it could mean that we're doing more tests or nag-increase nga yung testing capacity natin. But we wouldn't really know until, well, ako, hindi ko talaga masasabi until na makikita ko yung ilan ba talagang people yung natetest per day. Ika nga ni Dr. Leland kahapon, yung positivity rate. We don't know really kung how many of those being tested per day actually do turn positive. So yun pa yung hindi ko pa na masyadong naaral. So based on the current data, it does seem like we're doing more tests. Wait, I think nawala ako.
In America,
Hello?
you're good.
Okay.
Yeah.
But the good news is definitely we're seeing a decrease in the percentage of people who are dying. So at least kahit na tumataas man yung cases natin, less and less people are actually dying of COVID. So it could be that doctors and hospitals are getting better at treating COVID. That's the good news.
Yeah.
But another way to interpret it is baka din we're doing less tests on the severe patients. Tricky siya nga data, and it's very hard to draw conclusions from this alone kasi.
Actually, ito yung sinasabi mo, no? Kasi oo nga, nung konti pa yung cases natin, ang taas ng mga namamatay. At marami pa nga mga namamatay dyan, if I remember correctly, mga frontliners, mga doctors and nurses. Pero ngayon na mas mababa na yung ating yung ating mas mataas yung ating cases, pero mas mababa yung namamatay. So perhaps that's the explanation that you were giving. Pero dito, can you enlighten this one? Yung percentage ng symptomatic, mild, severe, critical. What does this all mean? Parang ako natatakot din kasi ako mag-comment because it may send a bad
And
message.
nag-echo ka, sir.
Ha?
Sorry.
Nag-echo ko? Ayun. Ano yung chance na critical yung mapupuntahan ko kapag nagka-COVID ako?
Well, based dun sa nakita nating figure, around 2 to 3% yung nagiging severe and critical. It would be, siguro hindi pa ready mag-hazard ng guess na around 2% to 3% lang yung chance na ma-hospital ko. Parang it's too early to say.
Okay.
But it would be around that number if I were to hazard it.
Yung sa WHO, yung nakita nilang hatian is 40% mild, 40% moderate, 15% severe, 5% critical.
Okay.
So if you have COVID, you have a 5% chance of getting severe, yung critical, 15% of severe, tapos 40 evenly for mild and moderate. But again, this depends on your personal risk, which means if you yourself have an immunocompromised state, or if you have hypertension or diabetes, then you really are more at risk. Also, if you're elderly, So, yung disease na to, this could blow through the entire population naman, with leaving most of them supposedly, as far as we know, given our very small limited data, most of them okay. Pero yung pinaprotect natin dito ay yung mga vulnerable, the elderly, the sick. So sila talaga yung at stake at sila talaga yung pinaprotektahan natin by staying at home, maintaining our health protocols and safety protocols. Yun po.
Okay. Tapos itong next ay hospital beds and mechanical vents for COVID-19, and then temporary treatment and monitoring facilities. It's also figures coming from the DOH. So yung sa narinig ko sa inyo kanina, it seems like ang sitwasyon natin ay madami tayong facility for the mild, moderate, and asymptomatic. Pero pag dumating ng severe at critical, medyo dun magdedelikado. Tama ba yung ganong interpretation?
Tama yon. Kasi kapag severe or critical ka na, most likely sa ICU ka na papasok. And not every, kulang yung ventilator capacity ng Philippines to service every potential na person who needs to be admitted. So if we assume na lahat ng may high blood, lahat ng diabetes, simba ko, mapupunta sa severe to critical COVID. Even if they didn't get it at the same time, malamang kulang na kulang yung ventilator capacity natin.
Okay. So sa mga probinsya ninyo, may mga ICU beds ba? Yung public hospitals?
We have 7 to 9 last I checked sa public hospital namin.
7 to 9 ICU beds.
Yes.
Okay, so kung kung 1% yung nagko-critical and severe, 1%, so 700 cases yung pwede tayo sa inyo, no? And 7 will be sa ICU. So yun yung, if we do the math, no? If I were to look at it, okay, so up to 700 buhay pa kayo. Pero more than that, delikado na. Sa inyo, Raph, ilan yung inyong ICU beds?
I'm not sure about the ICU beds that we have, but at the COVID facility, they can go up to 200 for the entire province na yun. And then, pero again, much less yung ventilator number namin, as in like very few.
Pwede ba
Surprisingly
mag-isip na lang tayo
few.
ng mechanical? Marami tayong manpower. Ganun lang natin.
Very few. Also to comment on yung community isolation space namin, we didn't, yung space namin was designed, well, it wasn't designed. Yung original purpose namin was to house those mild cases. Pero ngayon, ginagamit namin siya not just for mild cases, but also to quarantine all the new repats or the new OFWs, LSIs, stranded individuals that we have to take in all of a sudden. So much of it is used there. So ngayon, scarce na siya for the LSIs, and then scarce na siya for the mild cases that we have. And then for my municipality, so many OFWs kasi come from Tiboli. And then so many of them continue to trickle in. Napupuno na rin yung space namin, sad to say. And then with that, we need to make new space. So we need to constantly build new space and invest in that infrastructure, because we don't have a choice also. So adapt lang na naman yung LGU.
So actually yung naisip ko na parang okay, at the community level, very critical pala talaga din yung pag-aayos ng logistics for isolation, kapag lalong-lalo na pag yung LGU isolation facilities ay napupuno na. So I guess ito yung takeaway ko for this interview sa microfinance program namin. Yun yung gagawin ko na okay, pag puno na doon, yung mga magkakapit-bahay, pag may nag-positive dyan, o evacuate yung isang bahay, makitira muna kayo, ito yung gawin natin na bahay, isang bahay for the isolation. as a a stopgap measure kung ubos na yung sa isolation facilities. Okay. Sige. So actually si Julie Rose sabi niya, so more power daw to the doctors, to the virus, especially sa inyong dalawa. So marami nagpapasalamat.
Hi, Ma'am.
Totoo.
Hi, Ma'am.
Ang daya. Hi, Mami.
Planted.
Okay, nanonood sila ngayon. Okay, so mabuti naman. Okay, so yun, ang dami talaga nating natutunan ngayon, no, about this, and maski ako, there are questions on how how COVID-19 should be managed at the community level, at kayong dalawa nga talaga were very speaking from experience, yung pagbibigay ng examples at sagot kung paano i-manage at the community at the family level. Okay. So we're nearing our end of our live session, and of course hindi ko naman ito papalampasin na hindi ko kayo kakamustahin dalawa, 'di ba? Eto na. Handa na ba kayo? Joke lang. Ayan. So sa tingin niyo ba kayo ay tatagal? Chad? Will you be able to finish
Oh, no. I think nawala ako.
Nawawala ba? Will you be able to finish? So sabi ni Raph, oo daw. Ikaw, Aimee, tingin mo ba ma-finish
ano
mo
ba yung question? Nawala ako.
matatapos mo ba yung 3 years post dyan? Tingin mo?
Ano?
Yung 3 years post mo dyan sa as a doctor to the barrios?
Ano yung gagawin ko after?
Tatapusin mo ba talaga?
Ay, malamang.
Uy, nawala siya. Ayan. Anyway, so Raph, ikaw muna yung kausapin ko. And so ano yung adjustment na ginawa? I hope kasi na other medical students or even other doctors will be able to watch this and be inspired to become a doctor to the barrios. And so ano yung adjustment? Naku, nakikita ko yung tinitirahan mo ba yan? Yung area na yan ngayon? So, para ka bang nag-JVP, immersion? Ano yung adjustment na kailangan mo paghandaan?
Nung nagsimula ako dito sa Doctors to the Barrios, sobrang yung expectations ko were very, very, very modest.
Mm-hmm.
Naisip ko na parang super simple lang yung bahay ko. Sobrang as in baka hindi de-flush yung toilet ko, buhos type toilet, or yung walang toilet seat, or baka walang tubig, or walang kuryente or something like that. But surprisingly, ewan ko ba, kasi I got really lucky. Yung municipality na napuntahan ko is pretty well off. It's a first-class municipality. And then, may 7-Eleven dito.
Oh!
Tapos may BDO pa. Tapos, I actually live in a resort.
Okay.
So,
nice.
Medyo outlier yung sa akin. I didn't have to do so much adjustment. If anything, lahat ng mga adjustment na nagawa for me has been very positive kasi dito walang traffic, I get fresh air all the time. Sobrang mura lang ng prutas at gulay, like a durian in Manila is like how many hundreds of pesos for just a small piece. Dito I just buy 2 for so much less. I mean, and then this place is also coffee country. So marami akong coffee na nabibili for cheap, really good coffee too.
Mga nilang pinala, of course.
So ayun din, it's very enriching to be part, to join the community, to be welcomed by them. It's something that you never ever get in a hospital. You don't get the kind of understanding of the social determinants of health. Yung level of understanding na kaya pala ganito yung access niya sa health kasi dun sa barangay niya there are no formal roads, or every time na umuulan nagbabago yung shape ng road, or Yung kinakain lang ng mga bata doon is kamote and no eggs. So may madalas yung protein malnutrition nila. And then they don't have access to clean water. Hindi mo yan maintindihan sa hospital kasi you're seeing the end product of all the injustices na nangyayari sa kanila. Yung kakulangan ng society natin to cater for those that can do more sana, pero because of historical prejudice against them, the constant their inability to participate in the political system. It's those kinds of things that have kept them at this level, and those things you don't see in the hospital.
Right.
I really recommend and I wish na natuloy ito sa UHC law na lahat ng mga medical students ay required to do this kind of work.
Wow.
Kasi sa UHC law, state colleges and universities lang or their medical students are the ones who are required to do this kind of work now. Unfortunately, private universities can opt out of this kind of stuff. Sadly, because I think so much of hospital work has been centered, so much of medical work has been centered outside of where it is most powerful, which is at the primary care level. Kasi you can do so much when you're at the end of the line already, when you're a critical care intensivist. Peace out to my professors. You can only do so little na lang eh. The amount of cost versus the benefit that you get, the number of lives that you can save is so much less compared to treating hypertension, treating diabetes, treating a healthier diet at this level pa lang. You can stop all of those things if your primary care system is working, if it was given the attention that it should have been given. If you work harder to stop people from smoking, you wouldn't have so many heart attacks sana. Then you wouldn't need to spend millions of pesos to do a stent. Sobrang it just the economical implications of investing in good primary care. Ayan. It just speaks for itself.
So
and I wish
parang prevention is better than cure talaga. And to do the prevention work, nasa primary healthcare yung binabanggit mo. Nako, alam mo ako, malapit na akong umiyak na, oh my God, ganito yung mga iniisip ng mga estudyante ko. So akala ko ako lang yung ganito, yung may care sa lipunan. So yay! So ikaw naman, Aimee, ano naman ang kalagayan dyan? Ano yung adjustments? So ito, nasa resort, si Raph, ikaw.
Oh no, it's really hard to follow that up. I mean, and dami yung sinabi that was so good. And he said it so well. Well, ako naman dito, I'm in Higakit. It's like a coastal little town. Parang population 24,000 sa may, Surigao Norte. And, ano yung question? Kamusta ako? Am I still on the air? Oh no, I think nawala ako.
Yes, we are.
Kamusta ako? Ano ba yung question?
Just yeah.
So far, I really come to love my area. Tapos yung thing that I love the most about it, siguro yung mga attitudes ng mga taga-baryo. Although hindi naman talaga makakonsider as baryo yung area ko kasi may kuryente, may running water, may malakas na signal. Na mas malakas pa nga dito compared sa bahay ko sa Cagayan de Oro. So, it's not the most baryo. But it's a poor municipality, definitely. Tapos may mga areas din na malalayo na talagang they would have to hike for an hour or more just to reach the nearest nga health provider. So that's me. But here in my area, it's sobrang okay dito kasi sobrang okay ng staff ko. At I have a complete set of nurses, of midwives. Tapos may boss pa ako na isang doktor. So I'm not actually alone here. Okay. So nasasabi ko lang na actually sobrang swerte ko sa Higakit because if you want to go to the beach, ayun, may beach that's just like, as in literally outside my house. If you want to go up into the mountains naman or mag-waterfalls, meron din dito like 15 minutes, 30 minutes away. So parang it's like a jack of all trades sort of area na parang may coastal, all the charm of a coastal area coupled with the adventure of a mountainous area. O, di ba parang ang shallow ng sinasabi ko compared sa kay Rap. But
O hindi naman, hindi naman. Pareho lang kayo yun. Anyway, ako actually to hindi ko mapigilan sagutin, no? Ay tatanungin at winarningan ako dito, but I'll take my chance. So, nami-miss niyo na ba ang isa't isa?
no, not really. Hindi naman.
Ganun ba yun? Okay, pero Aimee, merong nagsasabi, si Anna, sabi niya, ang ganda mo daw. Okay, so, ano natin yan. Tapos sabi rin ni Tracy, salute to to Barrio Doctors. Maraming salamat daw sa inyong sakripisyo. May God protect you always. Mabuhay kayo. Okay, yan yung sabi ni Tracy. Okay. So, ano na lang siguro, last words for this episode, no? Ano yung mga ano yung pwede namin gawin as citizens or bilang mga na mga hindi pasyente or karaniwang Pilipino, ano yung dapat namin gawin para maka-contribute ng solusyon dito sa COVID-19?
Sige, Rap.
Sige, Rap.
A lot of the time kasi yung health natin is the decisions or the outcomes, yung result niya, responsibility falls on you. Falls on the individual person. Pero sa public health, ang pinaka-importanting person or may pinaka-power to determine how your entire community is going to go is the mayor and the governor. Kasi devolved ang healthcare system natin. Sila po yung nagdidikta kung ano yung prioritization nila. Sorry, may manok. Ina-attack yung...
Okay.
Yan yung barrio life ko. Manok. Okay. Okay, sige, where was I? Most important person who decides on how your public health system will go is the mayor and the governor. I think it's been very clear when we're talking about certain provinces like Cebu, how important the governor is, how important the work that the governor is in investing in health, in investing in the correct kind of public health measures. So kayo mga convincers, yung mga viewers ngayon, please communicate and then express your desire po sana for a better public health system kasi it's only by participating in the decision making and pressuring po those who make the decisions that we can achieve better health outcomes for everyone, especially the poor. Napaka-importante po ang pag-participate and holding them accountable to the policies that are being done at that level. Also giving credit where credit is due. If kung maganda yung performance, recognize it. Pero kung kailangan pa ng improvements, voice it out. Okay, right. Always participate, okay? Hindi lang kasi sa social media yung importante, pero dapat maparating nyo talaga na ito yung karapatan namin. Health is a right for you, so fight for that right.
Okay, so dalawa actually nakuha ko sa iyo, Rap, no? Ang una, actually sabi mo ay, hoy, mga convincers, bumoto kayo ng maayos kasi yung mga governor and mayors, sila yung may responsibility dito, no? So if your mayors and governors or officials are doing well, re-elect them, but please kung hindi, wag nyo na silang iboto. Tapos pangalawa, ang sinasabi mo rin ay, ano nga yung pangalawa? Give credit to where it is due. So i-recognize natin sila. So yun, i-balance, hindi lang reklamo pero magbigay din tayo ng papuri. Okay. So yun naman, Doc Aimee.
Well, sa akin naman, we really need you to support your frontliners kasi for sure by this time pagod na sila. They've been working non-stop since March. So ilang months na yun, March or February. So please, the small things help.
So like what?
Namimigay ng pagkain.
Okay.
Chocolate. Yeah, support your frontliners, please. And like yung sa experience ko kasi, we receive a lot of actually discrimination and hate, especially from those na ina-advisean namin to undergo quarantine. And that's like one of the things that breaks my heart kasi naawa ako sa mga tao na I have to tell them, oh, you have to really just be away from your family for 14 days. But at the same time, it's what we need to do to protect each other. So please support your frontliners too by, if you know anybody coming home, bali, take part in that mental preparation na, okay, you will be quarantined and I will support you. I won't discriminate you when you come home. Ganon. We need really to be there for each other.
Oo. Actually, no, mga bayani kasi talaga itong mga frontliners. So sana ay mas inaalagaan natin sila kasi they're the ones taking care of us, 'di ba? So napakaganda niyan. Pero magandang tip din 'yon na pagkain pala. Okay, sige, madali lang naman 'yan, 'di ba? Sa kapalit, no? So maraming salamat sa inyong dalawa, Doc Aimee and Doc Raph. Okay, sana magkita-kita tayo next time. And I hope yung ating pinaplanong mga clinics sa aking mga probinsya, gagawin natin yan. I'm already talking to the DOH and PhilHealth. And mukhang ang isang ruta nga ay baka daw mag-assign ng isang doctor for the barrio sa SEDP. So, tingnan natin kung ano yung ano yung mangyayari, no? So, yun, maraming salamat sa inyo. So, sana ay hindi kayo tamaan at dumami pa ang mga katulad ninyong mga doktor that would answer the call to deliver services where it is really badly needed, no, at the primary level. So, maraming salamat at mabuhay kayo. Okay.
Thank you, sir.
So bye-bye muna tayo kila Doc Raph at saka kay Doc Aimee. And okay. So yun, no? So yan ang ating discussion ngayon for our Usapang Pera Live. At nako, grabe talaga. Yung puso ko umaapaw kasi si Raph at saka sila Aimee at yung iba pa nilang mga classmates, actually, yung batch nila very memorable sa akin yan dahil marami ang nag-med school doon, tapos maraming matatalino yung sa batch na yon, no? At hindi ko yata nasabi sa kanila na yung kanilang batch isa sa mga pinakamatataas na grades na naibigay ko. And yun talaga, it fulfills my mission as a teacher na namumultiply ko yung sarili ko na, of course, hindi ko kagagawan na ganyan sila mag-isip, no? I did not do that alone. Pero I would like to think that I was able to contribute and influence them. That's why they think that way. So, yun, nakaka-proud and I'm really proud of you sa mga ginawa niyong decision, Raph and Aimee, to be part of the program of the government, Doctor to the Barrio. So sana ay magamit natin itong mga impormasyon na to at hindi na tayo hindi tayo tamaan ng COVID, o kung tayo naman ay tamaan ng COVID ay alam natin yung gagawin natin. And of course, yung pinag-usapan natin kanina sa ating unang mga segments, how to prepare financially for all of this. So, magandang, sana ay marami kayong natutunan sa ating episode ngayon. Maraming salamat sa inyong pagsama sa akin. Ako si Sir Vince, dito sa Rizal, nagsasabing ang pagyaman na pag-aaralan.